Burnout can be experienced at many different ages, as you're
Absolutely.
very
Yeah.
familiar with. I think why the incidences are so pronounced in menopause specifically, I think the beginnings start in perimenopause. And menopause, just so we're clear, and I'm sure your audience knows this, is when a woman has not had her menstrual cycle for 12 consecutive months. So we have to think about, again, now we're looking at hormone deficiency situation. That means that our stress hormone is also very vulnerable to our progesterone and estrogen deficiency. So if a woman's work history, for example, has been persevering, pushing through, doing the caregiving, raising the 3 kids, walking the 2 dogs, in addition to being in full-time work, our poor little stress glands, our adrenal glands, they're the ones responsible for, okay, well, all right, there's a lot of stress on board. Let me give you more cortisol. They eventually experience fatigue. So physiologically, burnout is low cortisol. And then throw in even more acute stress of caregiving for a parent, for example. I describe the patients as the tank is empty. Right. So
Yeah.
if the tank is empty already going into menopause, then what that's going to look like in menopause in the workplace specifically is stress leave, short-term leave. And then we can talk about, is that beneficial for everybody actually? And most often with my female patients that I'm working with anyway, it's not, because the caregiving is still occurring. Now we've just taken the work out of the equation, but then the stress of how am I going to be able to reintegrate into work? So that whole psychological stress that comes with a stress leave, that comes with a medical leave, and women really thinking, how am I going to reintegrate? I have a few patients right now.